afternoon, and welcome back to another series of the Faculty of Pharmacy webinar. And so today, our format is going to be a bit different. We're trying to go into a different direction. And so today, our webinar is not going to be really be a webinar. It's more of a conversation that we're going to have with someone from our own faculty. So today we have the infamous Dr. Ahmad, who is actually really famous all around the world. He has traveled all around the world, and so today he will be with us today. And joining us today is Dr. Ahmad. So, Dr. Ahmad, how are you doing?
Good afternoon, dear Mr. Danish. Good afternoon to you, to the entire faculty, and to MASA community. I'm great, thank you so much, and I'm quite excited about today's talk. If we say it's more like a podcast, more like a podcast than a webinar, but yeah, we'll try our best. And thank you so much for having me here today.
Yeah, I guess it's because most people are just going to sleep whenever you hold out a PowerPoint slide. So I thought that today we're going to go into a
Uh,
different.
Yeah, I guess also because a webinar in the traditional way, it feels more like a lecture, and I think everybody is already bored of taking lectures every day, even Thursday. So on Thursday, so yeah,
I'm
okay,
definitely bored. I have enough of lectures, to be honest.
okay,
Okay. So today, Dr. Ahmad, when I came to you with the proposal to do this, you wanted to talk about digital healthcare, and so
yeah.
I guess for a lot of people, including myself, we have heard of digital healthcare before, but we're not sure what constitutes as digital healthcare. So could you just care and explain to us what is digital healthcare?
Okay, so in a nutshell, digital healthcare is the process of utilization of technology and information in healthcare system. So practically, we are moving in the current era. We are moving from like physical patient records, like having traditional pen and papers and a lot of paperwork, into electronic one. So digital healthcare emphasizes on things like electronic health record, electronic information, mobile health, telemedicine and telehealth, wearable devices, uh, and these things are becoming more accessible and available in mass or in public. That include also AI, which is now is being integrated in healthcare system, and the exchange of information, and the virtual reality, augmented reality, remote patients. Monitoring and counseling, that's also a part of telemedicine. So practically the purpose of digitalization in healthcare is to um, improve healthcare system quality of life of patients, is to improve also the clinician experience, to reduce the cost as much as possible, to facilitate the process, and to like to make it much easier, much convenient, and to reach out to reach out to as much as many as possible patients out there. So the strategy which are being implemented in this process, something called a stay left, shift left, which means, and we are trying by digitalization or implementing the latest technology in healthcare system, we are trying to help people who are well stay well, and move as many people or as many patients who are improving as soon as possible from the critical care into the safety, or into their home setting. So that's why we in digital healthcare, they invest more into things that are home-based care, things like monitoring devices, patches. Now, actually, in the market, uh, under trial, many patches are being available. Like you put the patch on your chest or on your arm, and it will show you the entire vitals, the patient entire vitals, and it will be live stream. It will be completely live stream, like real time monitoring for patients. So that will reduce also the load on healthcare professional in professional healthcare settings, like at hospital and tertiary settings. And that is of a great interest for us. The reason being, because currently it was clearly obvious during the COVID-19 crisis that healthcare system was overwhelmed with the number of patients. So when we are trying to keep people who are well at home, or people who doesn't need really a critical care, so at the same time we provide them with the service, with good quality service. And also we can predict and monitor. Like for example, there is a new device which was developed in Ireland. It's called Respricen, and this device they monitor the patient real-time patient respiratory rate and predict if the patient might have an asthmatic attack or dyspnea or something like that. So on a real time, the nurses or physician or healthcare team can intervene or ask or call for emergency. So so that is what practically what it does digital healthcare means.
All right. Okay. Okay, Dr. Ahmad, that was very long, but it's fine. But I guess what, because I felt like in a way you have already answered the next question I wanted to really ask you, which is what is the history really about the advancement of digital healthcare? So, Dr. Ahmad, you have been in practice before. So, can you just let the audience know how long have you been in practice?
Well, as being in practice, like in pharmacy, as a practicing pharmacist, it's not really very long time. It was for 3 or 4 years, and it was since 2012. But I moved on into research and into further studies like MPhil and doing in clinical settings, clinical work, and I become a clinician. Then I joined PhD. So but in the history of digital care, healthcare, if we can speak about it, you will be surprised to know that the first proposition for digital healthcare or for implementing electronic devices in healthcare was in 1960s. Of course, at the time, the technology was not available, the things were not up to date, and it was quite difficult. Then something happened that changed the environment, which is ARPANET. ARPANET, which was a project, it was a secret project actually, under the Ministry of Defense in the United States, and the idea was the birthplace of the internet. It was the birthplace of the internet. Then later in the 60s, in the 80s, the advancements in imaging technology and the invention of CT scans and all these kind of devices made the healthcare overwhelmed with the information. Actually, to be honest, healthcare is one of the most information intensive fields to work. So later in the 1920s, when in the US they have approved the Electronic Health Act, uh, things start to explode. At the same time, on parallel, the invention of smartphones came to exist, and then smartphones like facilitated these applications in healthcare system. And now we see wearable devices which are connected to smartphones. We can see monitoring devices, or things that can monitor all kind of things, like how many steps did you do, how much calories did you burn, can help you like design your health and diet, adjust your lifestyle, and remind you of your medication. But the only problem was how to connect all this kind of information together. And then in the 20th century, during around 2010, these things started to become connected using a health information system and EHR. So all this, the flood of information and data now can be centralized and can be put together. So in order to help the physicians and practitioners uh, monitor the cases closely.
I see. So I guess from your explanation, it seems to me as if that the advancement in technology has really came with giving pharmacists a different role as to how they've been operating before. And I feel that it would be quite beneficial if you can just explain to some of our audience who might not know what do pharmacists actually do in a clinical setting traditionally.
So traditionally, pharmacists are responsible for dispensing medication, reviewing medication, counseling patients, giving orders, maintaining or monitoring adverse drug reactions, monitoring the or adjusting doses for patients, like whenever it's needed, like based on their hidden health conditions or body weight or their kidney condition, or if they are suffering from liver disease. So all these kind of things they can pharmacists keep an eye on. Also, they are responsible for antimicrobial stewardship, which is the monitoring of the use of microbes or antibiotics to prevent resistance and reduce the risk of resistance. So that's in a nutshell what are the jobs of pharmacy. Also, they are responsible for educating and counseling patients and enlighten them about what they to expect when they receive this kind of treatment, and how to use them properly.
Okay, so obviously those are like the traditional rules, but
Yeah, actually, in real life, so we say in a very short term, physicians are expert in diagnosis and disease, and pharmacists are the expert in drugs. So whenever they need something, even sometimes physician, when they need to confirm something regarding this drug is suitable for my patient, they will consult, or they will ask help from pharmacists, because they know medication, they know only names, they don't know too much details about these medications, how the pharmacology, mechanism of action, dosing and adjustments, all these kind of things. They are more into the scope of pharmacy work.
okay. I guess that's really useful because I think for a lot of people they don't really understand what do pharmacists do because they thought that pharmacists just works at the counter and just give them
Yeah,
their med.
it's a part of job of the pharmacist.
I
It's a part
obviously
of their job, in especially in the community setting, not in the clinical setting.
mm,
It's a part of their job, definitely.
yeah. And so right now, what now going back to the topic, what do you think are the advancement? For example, the advancement in digital healthcare that has shifted the pharmacist's role because you have mentioned quite in an extensive manner over the things that a pharmacist is supposed to do, the roles that they do. But right now, because of the advancement in digital healthcare, how has that role evolved?
Okay. Now, for example, the implementation of electronic health record. Now, the pharmacist now they can monitor closely, and they can monitor the patient's condition closely. I will give you a scenario or example. So, assuming that we have patient who is connected through the internet with multiple devices, and he need to do his annual checkup, and he want to do A1C test, which is for diabetes. And then the moment it pop up to the pharmacist, the moment he do it, it pop up, it will show up in the pharmacist side, like, okay, this patient has like increase, or his diabetic condition is getting worse, and his sugar level is increasing. So the pharmacist will approach the patient, and the patient now at this situation is still at home, by the way. So the pharmacist can approach the patient and contact him regarding his medication, and arrange if it is needed to increase or adjust the dose for the patient, if this patient is suffering from diabetes type 2. So this is one of the rules. Another rule can be like, whenever the doctor is prescribing, or they are or using the EHR. So when the pharmacists want to approach the need to approve, sorry, want to approve the medication, uh, there is two types of alerts that can show up on his screen now, because everything now is digitalized. We are moving from like the old style. You have many shelves and many old jars that the pharmacists need to pick up medication from and arrange them and give them to the patient, to electronic devices. So it will pop up on his screen two types of alert might pop up to him, like active and passive alert. So, for example, let's say in the active alert, a pop-up screen will show up that this patient might be suffering, because all information about this patient was already saved in the record, like even genetic information, risk of disease, many variables. It will pop up that might be overwhelming to anyone to notice that this patient might be suffering from cross sensitivity. From what? From something like cephalosporins, for example, cephalosporins, because patients who are sensitive to antibiotic, like first generation first generation ampicillins, or amoxicillin, for example, amoxicillin, for example, they might have cross sensitivity towards cephalosporins. So it will pop up to his screen that this patient is suffering from this, and you should be aware that you do not dispense until you double check. So this is the kind of things that might be changing. Or another thing that might be, if we can share this video with the audience, Danish, yeah, here,
So to
like
begin, the monitor
in a community, in a clinical setting now, the traditional rule of a pharmacist has changed in a way that it's not necessarily the hospital pharmacists need to visit every day, to visit the ward, or to visit the this section, or the wherever, like for example the emergency room, to supply the medication. Instead, it's just he need to fill up this machine, which is an automated dispensing machine. Of course, it depends on the access to this machine is limited, and it's based on encoding system. So now this machine will be operating 24/7. So he need to fill up this machine, and whoever need, let's say, in an emergency situation, they need to get access to emergency medicine, and it was like after midnight, for example, then they can get access directly. The nurse can approach this machine, and nurse, even though the pharmacist is not available on call.
This is your automated dispensing cabinet. We're going to start off with reviewing the different components of hardware. So to begin, the monitor here is all touchscreen, and this is referred to as your display terminal. This is where you're going to log in, see your patient information.
So here the patient, here the pharmacist needs to log into the machine and double check everything is in order. All medication according to the ward's needs are already supplied, and then
now I'm going to
verify
show you
it.
the different types of drawers within the cabinet. This entire unit here is referred to as a drawer module. Within the drawer module, there's different types of drawers. The first type of drawer is a matrix drawer. It's going to open, and you will have 3 to 6 different types of medication.
So here in the drawer system, as you see, there is multiple types of drawers. Drawers for controlled medicine, or medicines that are, if we say they are opioids, for example, strictly controlled medicine. So, and drawers for general medications, like let's say for analgesic, antibiotics, or NSAIDs. So these, usually the drawer will open and it will show the entire floor, the entire medication that were supplied. While on the other hand, for the drawer for the controlled medicine, it will be blocked with the metallic sheets, and it will open only the dose that is for this patient. So no one get access to the other medication which are supposed to be given to other patients. That's, for example, in case of narcotic drugs.
In the drawer. The cabinet will tell you the specific letter associated with the medication that you are looking for. In this case, spot C refers to spot C right here. The medication will always be in the spot in front of the letter. When you're done dispensing, simply close the door. The second type of drawer is a single item access drawer. This is primarily used for narcotics and controlled substances. So what will happen is the drawer will open, and there will be a sheet of metal over the types of medications you are not permitted to access. Only the medication that you are trying to dispense will be available for you. Narcotics and controlled substances will be prompted to count the quantity that's remaining in the drawer after you dispense the medication. So you will simply dispense your medication and count the quantity remaining. There will be a prompt on the screen.
So here, the whoever the health practitioner who is trying to administer or get access to this medication, they need to double check that everything is in order and there is no discrepancy. Otherwise, the machine will not dispense the drugs to the health practitioners.
To enter that quantity. If you did not enter the correct quantity, a message will ask you, are you sure? That's your opportunity to recount the quantity in the drawer. If you continue to enter the wrong quantity, you will create a discrepancy. The next piece of hardware that I'm going to refer to is the unit dose module. Only 2 East and the emergency department have a unit dose module. This is also for dispensing narcotics and controlled substances. It's essentially a large vending machine. Made of coils
Now
that
here
contain
in this section,
both
it
metal
literally looks like a vending machine. And by the way, now in Germany there are medication vending machines, like really like, but of course it will be inside the pharmacy. It will not be in the streets. So yeah, so usually the practitioner will not see here this area because the access here is limited to the pharmacy, because the pharmacy to the pharmacist, and the pharmacist need to fill up this section here.
dosage forms, ampules, and vials. There's different size coils depending on the size of the medication. So the medication gets loaded in here by pharmacy. Nursing will not have access to anything in here, but it's interesting to at least show you what it looks like in there. What will happen is when you dispense a medication that's loaded in there, the coil will turn just like in a vending machine does to drop down your bag of chips, and the medication will drop down into this pocket here. The final piece of hardware on these stations is a supply cabinet module. So what will happen is, if you're dispensing a medication that is stored in the supply cabinet, the entire door will open. Obviously, a lot less security for these items. Primarily, OTC products, bulk bottles, and larger IV medications such as Flagyl, Cipro, and Avelox will be stored in these drawers here. Again, just as with the matrix drawers, a prompt will appear on the screen to tell you the location of the medication that you are trying to dispense. All of the medications in the top row will be labeled as the 100 series, and then subsequently 200 series in the second row, 300s, 400s, 500s, and 600s. When you are done dispensing your medication, you can close the door.
Yeah. So this kind of solutions were implemented in the US probably more than 10 years ago, though they are not available everywhere. I'm not sure how available they are here in Malaysia. Another advancement or something that is let's say disruptive technology in the work of pharmacy or healthcare is the automated dispensing machines, which are used in a hospital settings or in a pharmacy, and they call it smart pharmacy. Now, if we play the second video, Danish, can you play?
Yes, Dr. Ahmad. You want me to play the second video? Is it the
Yeah. The second video. Can you play the second video?
Is this one? Omnicell?
No, not this one. No, not this one. No.
Is this
The
one, right?
other one. The other one. Yeah. Yeah. So here we have completely automated dispensing machine, which can be used in like outdoor pharmacy, not in hospital setting. There is a version of this machine. It's called Omnicell, by the way. It's produced in the UK, and it is much faster and much accurate, and reduces the risk of error during dispensing. So it can like dispense around 12 prescription per minute. So whenever the pharmacist receive the prescription, how does the pharmacist receive the prescription? It will pop up on his screen. The moment the physician prescribed the medication, it will pop up on his screen, and then he need to double check everything in order, the right drug, the right medication, the right dose, the right time. And then if he approves, then it will go to the order will go to this machine, and the machine will prepare it and give it on time, just very quickly, within less than 30 seconds. It will be ready to be dispensed with the instruction and orders and everything. So here is how it goes. By the way, this machine is now available in Gulf countries, like probably most hospitals in the UAE. They are utilizing most public hospital in UAE. They are utilizing this machine, and also in Qatar, and few hospital in KSA. So another advantage of using this kind of smart machines or automated robotic dispensing machine is that this machine already knows where is the drug. So it's not like, okay, I need to search this area to find this drug here or there, from this shelf or from that shelf. It directly move the arm, the robotic arm move directly to the drug, pick it up with the specification, and the sticker will be placed on it, on the drug, with the instruction to use, and ready to use immediately, already printed out and ready to use. So yeah, I guess there is a huge shift and change in the pharmacist role, and also this reduce the workload on pharmacists and make it much faster and less waiting line for the patients.
Okay. Right. I could definitely see how I would say that technology has definitely made things a lot easier for pharmacists, but all the videos that you've shown seems to be not within the Malaysian context. So from your experience within Malaysia, do you think we do have Malaysia in general has any technological advances that we see in clinical settings?
In fact, yes, they do. They do here in Malaysia. Actually, the Malaysian Investment Development Authority has approved e-health strategic plan, and they developed something called My Health Portal, where the healthcare community and the practitioner can communicate and pass knowledge and information. Also, they have signed a few memorandum of understanding with telemedicine development groups in order to develop something called tele-pre-care, which is designed to facilitate telemedicine and telehealth for primary care settings. Also, there is during COVID-19 era, here in Malaysia, in Kota Damansara, they have a company called DF Automation and Robotics developed a disinfecting robots which can be used at hospital. If you help me and play the third video. So this kind of robots are much more effective in disinfection, especially for radiology rooms and hospital corridors or whatever place you are trying to disinfect. It's basically an autonomous robots that utilizes UV lights in order to disinfect the intended area. And it can, like, let's say if you want, you can program it, or you can plan it ahead, like to start, let's say, midnight, and the robot will start working. Everybody is off now, let's say, at home, and the robot will turn on and will start moving on and will start disinfecting the area that you are planning to disinfect. And after it finishes its works, it goes back to its station and sit there for recharging. So there is two versions of this robot, one which is using UV lights, and the other version which is using chlorine solutions and isopropyl alcohol. So basically, these robots are also equipped with AI and LiDAR detectors and cameras. So whenever it detects personnel or people moving around close to the disinfected area, it will automatically shut down, because already we know UV light is dangerous, and also if it is using fumes and chlorine, then it might be also irritating to respiratory tracts. So quite efficient and quite safe to use. Okay. So basically, also these robots are, five, according to research, they are 5 to 10 times faster, and 5 to 10 times more effective than human disinfecting team, whoever are trying to work in the hospital setting or the intended area. So okay, so now for no, Danish, actually, you played this video quite early.
Yeah. So
I hope that
yeah. So
answered the
thank you. Yeah.
question.
Yeah. So okay. So I
I just
think that,
uploaded. I uploaded the video just because
yeah,
I
yeah,
cannot
it's fine.
upload more than three at
Yeah, yeah,
mine.
that's
So
fine.
this is so
Yeah,
okay.
so
Yeah,
obviously I've looked through like all the videos, and it seems that the advancement really is quite a lot. I guess the days of janitors and really nurses having to really sanitize the operation room, for example, has really gone now, and it really
yes,
has made not just the pharmacist's role easier. I would say that it has made the other professional healthcare as well, and
yeah.
has
It's quite convenient actually, because now no need for you to wait until the cleaning crew or the environments control crew comes and clean and prepare everything. And in the meanwhile, the entire staff, let's say nurses or physicians or pharmacists, they need to step back or go out until the cleaning crew finish. No, these robots will do the job while you are at home sleeping. You come at morning, everything ready for you. So yeah, quite convenient.
right. So obviously from the videos, it seems to me that it has helped um it has helped the healthcare professionals a lot in I would say in really doing the mundane tasks now, meaning that you can now really advocate your energy and time into doing things which is more profitable.
Yeah, yeah, I agree. I totally agree.
Yeah, and so the shift now, I would say that the rules now has definitely shifted to a point where right now we're not really implementing it, but there are suggestions to implement telehealth into the equation. And so, do you think that telehealth is a great idea, and or do you think it would be unsuitable? Because really, I feel that the basis of healthcare really it's like hospitality, meaning that the patients are going to feel a lot better if they were able to get the service face to face through human touch. And so, for me, I just think that it's quite unsuitable. But I'm not quite sure what you think.
Yeah, okay. So the human touch, definitely, there is nothing like the human touch. But the difference between telehealth is that it provide timely feedback and timely care just on time. No need for the patient. It reduces also patient wait time. So no need for the patient to wait for a long time to get access to the physician. No need to get transport, especially in the area where the healthcare system or healthcare professionals are scarce, like in remote area or remote islands, or places are difficult to reach, or in areas where, let's say, transportation or access due to obstacles, let's say natural disasters or war or things like that, might be difficult to reach. So telehealth or telecare here now play a major role by counseling the patient, providing instruction, helping out the diagnosing. Sometimes early prediction during like telehealth or telecare can be done. Early prediction of signs and symptoms and risk factors that might lead to aggravation or fast prognosis of the disease. So yes, there are times yet that we need to get the human touch, and there are certain times that it's okay. We can do it at home, and especially now in the current era where technology is available almost everywhere, and even sometimes cheap technology. and wearable devices that are really affordable that can detect and monitor the patient condition. So it will alert the physician, okay, this patient is not doing well, so we need to contact this patient to take this action or follow this and take this drug or do that. So yeah, it I think it facilitates health and make the healthcare service more convenient.
All right. So I obviously think that okay, you did mention something about really speeding up the process of prognosis, right, and diagnosis. And so,
Mm.
and at that point in time, the clinicians through telehealth, they would have really all this wealth of information, all this data at their fingertips, essentially. And how do you think these large data sets that you're getting out of telehealth, out of really real lifetime data, is going to be able to help the advancement of personalized healthcare?
Yeah, exactly. Actually, now we can tailor healthcare services uh, according to patient need by making personalized medicine and personalized treatment. For example, it help out in biomarker identification and biomarker detection and in genetic variant detection by pharmacogenomics. Predictive analysis also can be done because the amount of information in the electronic healthcare and electronic healthcare information system is huge and immense, and we can utilize AI. We can utilize AI to help us tailor the treatment based on the patient need. I can mention an example for you. For example, there was a famous athlete man from the US. His name was Tim Shaw, and he suddenly suffered from ALS. ALS, by the way, is a neurodegenerative disease where the patient suffer from neural degeneration, and he become unable to move, unable to speak, and unable to do things, and he'll be practically paralyzed. And one of the most famous people who suffer from this disease is Stephen Hawking. So this patient, with the help of a most recent experiment that was done in Google AI lab, they designed, so the patient now, because of ALS, he cannot speak. His throat is already damaged and he cannot speak. And they designed a tailored AI device based on taking a previous like noises or voice when the patient is trying to speak, how he's trying to speak on voice up, though it's not clear, he cannot speak. But it picks the patterns, the AI machine picks the patterns, and based on his previous recording of his voice, they tailored a device or a machine that can speak on his behalf. So he mumbles up whatever which we cannot understand, but the AI machine can understand, pick the tone, what does he mean, and then it voice it up through a speaker with the same tone, with the same level, with the same sound that he used when he was healthy before he developed this condition. This is one example. Um, so yeah, so I think another example we can get from here, which is the utilizing robotic arms and robotic technology in order to like deliver medication um, to the patient, and without the need uh, of the healthcare professional to be present. For example, here we have the first autonomous needleless in autonomous injection machine, or robots, if we say. So, to my knowledge, robotic arms in surgery has been utilized before, but practically they are being under supervision and they're being utilized and used by the surgeons to do precision tasks. The surgeon, the robots can do much better, but they don't work autonomously. Okay, and this is the first example which utilizing the patient information. And let's say the patient will come with to do his like flu shots, and then the only thing he need to do is just show up his healthcare insurance card or number, and the machine will pick and give him the proper dose and proper shots or vaccine that he needs on time. So here's how this thing works. And of course, this thing will never work if this patient record was not available in the healthcare system. So it all depends on the availability of the data and the record. By the way, he can schedule, he can do everything that he wants accordingly online, and no need even to see like a nurse or a physician or a pharmacist to do this shots. And it is needless using a fluid pressurized stream injection. It will go through the skin, but the only like limitation for it, it only can utilize a small volume, because it is cartridge based and it is only small volume that can be injected through this needless injection, high velocity stream of liquid. So another example, if we like utilizing the AI technology, is retinopathy Google AI diagnosis project, which was done in India. They did the trial in India. So they utilized the AI capacity to learn, the machine learning. And how did they do it? They exposed the machine or the AI system to thousands, hundreds of thousands of image of retinopathy, and they were categorized into 5 categories, from healthy to last stage or in the stage. And based on this, the machine started to learn how to detect and how to diagnose retinopathy, and they have like incorporated this system into imaging machine, which is also completely autonomous. And the patient, all the things that the patient need to do, they come and they get the images, and it will send the diagnosis to the physician, and it will be double checked by the physician. The benefit of this, that it just, you can put the machine anywhere because it's portable, and the report will be sent to the physician. So it will reduces the wait time for the patient, and will give access to many patients who were unable to visit or come to the clinics to check. Also, the benefit of it, it can give you an early detection of retinopathy, because as we know, retinopathy is one of the complications that comes with diabetes. And the problem with the retinopathy, if it is not treated on time, it can lead to blindness. So then if the physician like approve that this is okay, verify that this is okay, this is the retinopathy, then the patient will be forwarded for laser treatments, and he will be like saved from the consequences, or be saved from becoming blind because of this kind of complication. Because it's, by the way, this retinopathy is asymptomatic, and for the most of the time, and suddenly when the signs and symptoms starts to show up, it will be a bit late to do the laser therapy.
All right. Okay. All right. Okay. Thank you, Dr. Ahmed. Yeah, it's really like, I mean, the needle injection thing is a bit. I never imagined that you could actually do that. To be
It
honest,
seems
or that you
it looks futuristic. It looks completely futuristic, like something from fiction movie or something like that. But yeah, it's happening. This is actually the first one to be seen. Of course, there is limitation, like also, and there is issues with it. Like for example, drugs that need reconstitution, you cannot use this one because it's only cartridge based. Also, the drugs which need larger dose or larger volume, you cannot use it. So also it is limited the availability. Also the cost, it's quite expensive. Definitely, this kind of thing is quite expensive. But monitoring devices and wearable devices are cheap and available.
okay. Right. So I guess throughout this session, you have been, I think, a really large advocate for digital healthcare. Is that correct? Can we assume that?
Yeah, I agree. I agree because things. To be honest with you, healthcare system, despite the fact healthcare system is one of the most healthcare industry, if we say, is one of the most information intensive industries in the world. It lags behind digitalization probably by 10 years. It lacks people. Like for example, the robotic arms. It's already in the car manufacturing industry. Now there is you have entire car manufacturing industry, like entire in the like production line that is completely autonomous, but you cannot see
Mhm.
that in healthcare. And I think the reason because of that is regulations quite difficult to get something approved for medical health or for medical procedure or treatments or for healthcare. Number two is security issues. Number three, like whenever you see a large amount of information or data being stored somewhere, it is now like in danger of like hackers or cyber security or cyber attacks that probably if someone get access to this information, these are very sensitive and very personal information. So maintaining the security, maintaining the data in safe places is very at most important in such kind of scenario. Also, there is the ethical and legal issues. For example, let's say we are using AI in diagnostic, and a mistake happened because of the UI, if from the because of the AI. So who would you blame? Who would you blame, right?
Yes, correct, correct.
And damage mistake happen and damage happen to patient. How would you blame? Would you blame the AI? Because also there is a chance of manipulation in the AI system, and people also actually are afraid of um, AI because they think, okay, one time the robots and AI will take over humans. That's not realistic. But yeah, people there is still suspicious about this kind of technology being implemented in healthcare system. Another difficulty or risk or challenge, if we say, is the maintenance. So there is two types of maintenance: the regular maintenance, which is planned out, that should be smooth, no problem. The other one is because of blackouts when black because these things malfunction sometimes. It's efficient, but might sometimes malfunction. It happens once in Düsseldorf hospital in Germany. So there was one patient they wanted to admit in an emergency, but the system was down for some reason, and they needed to transfer the patient to another hospital, and on the way the patient died. So this is another issue also. It is rare, but it might happen. And I think this kind of things also happen in settings like in normal settings, not only in the, let's say, most advanced digital settings.
Okay, right. I see. I understand that. Okay.
In
So
terms of, by the way, in terms of
mhm.
personalized medicine, also there is a new invention. It's called uh, polypill, which is a 3D printed. Now it's being studied in Nottingham University. It is a 3D printed pill which contain more than one drug. Let's say, for example, the patient is on aspirin and on AC inhibitors, like for his hypertension because he's hypertensive, and he's using statin also at the same time. So instead of using all these three, instead the patient need to use like 3 drugs or 3 pills, they use this single pill which is 3D printed, and the patient will take one pill that contains 3 layers of medication at the same time from totally different classes. Also, there is a new device developed by Carl Kraft, and this guy developed this device which is a personalized, also like dispensing machine, which was something like uh, if we can make a comparison, like a vending or dispensing or juice dispensing machine, the same way the vending machine that works, that mixes the milk with coffee and you get your coffee. Now instead you have micro encapsulated drugs, already custom made, personalized based on the patient needs, like in a cartridge put into the machine, and then the machine will dispense one dose whenever it's needed. What it will do, the micro encapsulated drug will be mixed in a large hard gelatin capsule, and he will have like 3 or 4 medication at the same time, that he can use only one pill at a time.
Okay. Okay. So do you think that is feasible towards the near future? Do you think we can implement that?
I think it is a bit futuristic now, because a lot of obstacles might be on the way to reach to the point that this kind of thing is available for people, because it might be expensive, regulatory issues, safety issues. Also, you need to make sure the medications are uh, they don't interact with each others. Otherwise, you cannot give them at the same time. Some medications you need to take at morning, some medications you need to take at evening. So it's not as easy as it look. But yes, if we can like reduce the number of pills we give to the patients, we might like make it much more convenient, especially with patients with amnesia, because these patients don't remember that I need to take like 8 or 6 or 9 pills at a
Hmm.
time. If we can give them only one pill that solves the problem, that would be great. But
All right.
still,
Okay.
yeah, advancement um, and innovations are still on the way, and we don't know. And these things are like going much faster than before.
Mm-hmm. Yep. Correct. Correct. I feel that we don't really know what's going to happen in the next few years. I feel like the environment could be in a
Especially
place where we could actually implement all this.
Exactly, especially with the presence of AI. Now, already pharmaceutical technology are implementing AI and using AI in drug design and molecular docking. So that make the process much more faster. What usually takes years to be done now can be done in months.
Correct. Correct. So yeah. So Dr. Ahmad, it is 1 hour now. Do you have any closing remarks for me? Would you like to say anything?
Well, I would like to thank you. By the way, before we close up, one of the implementation of the digital age now, or digital healthcare now, the use of drones in healthcare system. So let's say the patient needs to get his medication now. It's already now being done in the UAE and in Rwanda, where they send the medication to remote area using drones. So the delivery will be done using drone, and you'll get your medication by drone. So anyhow, for the closing, I would like to thank you so much for having me here. And yeah, uh, here I hope like in Malaysia that things go much faster and catch up, and definitely they will do, because they are trying to. Here also in Masa, we try to expose our students to the largest amount of that we can. Like for example, we expose them to electronic healthcare system in clinical pharmacy, in clinical pharmacy 5 and clinical pharmacy 4, whenever they go to the hospital attachment. And also we try to do telehealth, teach them some telehealth and role play, which they can do some kind of telepharmacy among themselves.
All right. Okay, Dr. Ahmad, thank you. Okay, so for the audience, to the viewers, thank you so much for being here with us today. Yeah, I hope that you have at least got a few things out of Dr. Ahmad's talk today. I suppose, is it a talk? Is it, or is it more like from our conversation, from the conversation that I had with Dr. Ahmad, you can say today. So thank you so much, and please stay tuned for our next webinar session. And have a great afternoon. Thank you.
Thank you so much for having me.